There's a local group dedicated to improving the quality of life for people with mental illness and their families. That group is Cumberland and Perry County's National Alliance on Mental Illness, or NAMI. Annie Strite and Jennifer Wilt are here. The Partnership for Better Health is sponsoring this segment so you can learn about this resource. Thank you for being with us today. What is NAMI? What's its history?
So NAMI is National Alliance on Mental Illness. It was started in 1979 from two mothers that had sons with schizophrenia, and they decided they needed better help, so they started their own organization, and that's how NAMI started.
I mean, bottom line, what is your mission?
So our mission is to support, educate, and advocate. Be an advocate for all of our families and loved ones suffering.
So how do you do that?
So with support, we offer free support groups. We have support groups for the mentally ill and for the family members. We have educational classes, which are 8-week long. And then advocate.
That's you.
We've been really appreciative, actually, of our local NAMI affiliate and their involvement with really expanding advocacy and education in our community around individuals with mental illness, as well as what we see as a significant unmet need for mental health services in our community. And they've been incredibly supportive and helpful just to provide that education both on a community level as well as then with our local legislators as well.
Well, there you go, making things happen, aren't
Yes.
you?
Awesome.
There's something coming up on the 14th, a nice event. What's that happening?
Yes, so the 14th is going to be, NAMI is going to be hosting a mental awareness walk. It's so people can come out, see that others are involved in the same plot that we are. So we're hopeful that we get a big showing.
I think folks then will see that they're not alone by any means. How can someone participate in that walk?
So you can go on our website, which is namicppa.org, and Eventbrite pops right up, so you can sign on. We have a barcode, do the scan, and hopefully we get a lot of people out for that day.
And on this day, it's for those who are battling mental illness, but as we said before, their families and support people too. Why is that so important?
It's so important because, like any other disease, we educate ourselves. So the same thing for the family members is we supply that education so you can better understand mental illness, which is a national crisis.
Is it fair to say if you are not going through a mental illness struggle yourself, and you haven't in the past, you really don't know what it's like?
That is 100% correct.
Yeah.
So that's why you need to have a better understanding of what others are going through. And it's 1 in 5. So we all know somebody that is diagnosed, has, lost their life, died by suicide, something like that. So it affects everybody.
Of course, we want to prevent that. Thank you so much.